Good morning, friends and neighbors. This is Michael Gershman with North Beach Community TV and NorthBeachNow.com. I am here with Susan Conniry and Community Voices. Susan, can you tell the people what they're going to be seeing here today?
Thank you, Mike. Yes. What we did was we invited people from the healthcare community to come and speak to us today. We have Harshim Ross, who is the Senior Vice President of CMAR. We have Tom Jensen, who is from Harbor Regional, the hospital. We also have with us today State Representative Mike Chapman, and he will be answering questions on a state level. And the fourth person with us is Len Cernoda, and she is our District Hospital Commissioner.
Outstanding. So what we have is a healthcare symposium with people who can actually give answers to questions, because a lot of people in Ocean Shores are concerned about the healthcare available and the availability of healthcare.
Indeed, and the idea behind today's presentation is that it will be mostly questions and answers, which we don't normally get. That's what Community Voices is all about. We want citizens to ask the questions. We need our presenters to give the answers.
Susan, thank you. And we are going to have a wonderful time today.
Thank you. And we do have everything set up and ready to go. So it's my pleasure to introduce our first guest, who has traveled a long distance to come and see us. We have not seen him in some time. It is a delight to have our 24th District State Representative, Mike Chapman.
Thanks everyone. A great turnout. Obviously, I'm not a healthcare professional, so I know you want to hear from the healthcare professionals, but I do want to point out, obviously, healthcare during the pandemic has been front and center for a lot of folks throughout the district, throughout the state, and throughout our country. There's been some positives, or obviously are some areas where we still fall short, and making sure one of my goals, look, thanks to you, I have healthcare. You, the taxpayer, part of my compensation as your state representative. And one of the promises I have continued to make is that I won't rest until everybody in my district has health care and access to the health care that they need. And that's been one of the kind of foundational principles that I've been guided by. I will say our healthcare professionals, earlier this summer, the city of Sequim that I represent up north, I live in Port Angeles, the city of Sequim Chamber of Commerce had their annual citywide picnic, and the theme was thanking our healthcare professionals. And they were the Citizen of the Year for the city of Sequim, was the healthcare professionals, and I had a chance to say a few words. And that was an incredibly humbling experience, because I, as an elected representative, kind of pick and choose what meetings I had during the pandemic, and did a lot on Zoom. But those healthcare professionals work day and night for these individuals, for you. Never really, they didn't pick and choose who they met and the challenges that they meet every day. So I think wherever we go, we need to remember all the men and women who work tirelessly on our behalf, serving us. If we walk through the front doors, there's going to be a highly trained professional who will greet us no matter what circumstance we find ourselves in. For 2 sessions now, local community hospitals, much like Grace Harbor Community Hospital, much like Olympic Medical Center in Port Angeles, and a few others around the state, really do struggle with funding, primarily through Medicaid reimbursement rates and also some federal Medicare reimbursement rates. A lot of times the services they provide, and I'm not an expert on the numbers like they are, but the information I've been giving is sometimes their reimbursement rate is around 60 cents on the dollar of service, 62-ish, can bounce. Your Northwest Kidney Center gets about 58 cents on the dollar of service. Now, there's no other business in our communities that will stay in business if takes $1 to provide their service and they get 58 to 62 cents back. It doesn't take an economist or an expert to realize that's not a sustainable business model. So one thing we have been able to do for Grays Harbor Community Hospital is provide and for Olympic Medical Center, the only two hospitals, I believe, in the state that got an extra appropriation, thanks to my seatmates, Representative Theringer and Senator Vandewey, who serve on the Healthcare Committee, and then all of us working on the budget, we were able to get for 2 cycles an extra appropriation so that our local community hospitals in our district can continue to provide the services that they have. So, tons more work to do. And I'm not even here to I don't even want to take credit for that. That just is like something we were able to do. I told you, was at a groundbreaking for a new kidney center, Northwest Kidney Center Clinic in Port Angeles. And I said, and we were able to get some capital dollars to help with that project. But until their reimbursement rates, and until the hospital's reimbursement rates, and until our long-term care home reimbursement rates cover the costs, we in government are, in essence, not meeting our commitment to our public. And I'll talk to a group last week, and this will be my last point, something to think about. You hear a lot about government wanting to add new programs. And every politicians get elected because they want to add new programs, put their name on a new bill, put their name on something. But until we fund the programs that we have in place adequately, I don't think we should be adding new programs. I think we should live and try to get our Medicare, Medicaid, long-term care folks in long-term facilities, the same thing. They're pennies on the dollar. So that is my goal going forward, is I want to make sure that we begin to fund the programs that you all rely upon, that these individuals are trying to provide services and have their reimbursement rates cover their costs. Their labor costs, their supply costs, their power costs, their lease costs. It's not salaries per se for these individuals. It's the whole gamut of their costs, and that's something that I'm going to be focused on. Want to hear your questions? I know you want to hear from these two gentlemen, and for all three, but I'm done for now. But I'll hang around and can take questions. And thanks again for the invite.
Big round of applause, please. All of you have been to too many candidate forums where you're told not to clap until the end. Please feel free to do so at any time that you like. I'd like to recognize all of you for coming today, but we also have in the audience the City of Ocean Shore's Mayor Pro Tem in the back. Thank you very much, Dylan. And with his other hat on, he and his wife kindly donated the blood pressure monitor that is up for raffle today. Thank you very much, John, for that. We also have a representative from Ocean Shore's Fire Department. Captain Cool is in the back, and thank you very much for coming today, Captain Cool. I'm going to hand off the microphone to someone that many of you know well, Len Cernoda, who is our representative on the Hospital Commission, and she in turn will introduce the people that she is with. After that, we will introduce Harshim from CMAR. So if you would please introduce your people here.
Thank you, everybody. It's good to see you. Hope you're all staying dry. As Susan said, I'm Lynn Cernata, and I'm your district representative on the commission at Harbor Regional Health. And today we're glad to be here with our team to share with you the new things that are going on at the hospital, tell you where we're at, all the services we provide, and to answer questions that you may have. So first of all, I'd like to, go ahead and introduce, let's go here. I should introduce who's here. Tom Jensen is our CEO. He is here today with us. We have Chris Majors, and he is our Director of Marketing, and Elizabeth is our Director of Physician Services. Yes, thank you. Okay. And then I'll just step up here a little bit so I can see who I'm talking about here. These are my fellow commissioners on the board, and it's always great to spend time with them. They're very passionate about what they do, and I'm very passionate as well. We've got Chris Majors, and he is, see, I can't see. Yeah. I should know this off by heart. Chris Thomas, District 1. And then we have Michael Bruce, who is our president. He is the Westport Grayland District 2 area. I'm for District 3, which is the North Beach, Pacific Beach area. We've got Andy Bakar, who's for District 4, which is Hoquiam. Becky Walsh has been our longtime commissioner, and she has recently resigned, so we'll be recruiting for that position in Aberdeen. We'll be doing that, and that should be filled sometime at the beginning of the year. David Quigg and Scott Dilley are our large commissioners, so they service all of us. So if you have any questions, you can reach out to anybody on there, myself, Tom, anybody at the hospital, and we'll be happy to talk with you. Okay, that's my district, and that's me. And I just go through it, and you can see their respective districts, and the at-large commissioners serve everyone. This is my favorite slide, and I will go ahead if you want to talk about this, Tom.
Sure.
We rebranded recently, and we're now Harbor Regional Health, and the reason we did this was to bring us all under one umbrella. I was amazed at all the additional services and facilities we have, and I had known them, but to see them all brought together under one signage, under one roof, so that, not one roof, but under one umbrella, so that you know it's all part of Harbor Regional Health, I think is very exciting. So it helps guide you and let you know who belongs to our healthcare hospital. So I can do this if you want.
Sure. Thanks, Lynn. I appreciate it. It's nice to see some of you. If I haven't met you before, I'd definitely stick around after the show, and if you have questions, I'm more than happy to answer them. As Lynn said, we changed our name because originally it was just Grace Harbor Community Hospital, and what people didn't realize is we were much more than just a hospital. We have all kinds of specialty services, and the slide that you see in front of you on the TV, it represents exactly what we do at this point in time. So that's why the name changed for Harbor Regional Health, because that's our focus. Next slide. Prompt care. Elizabeth, you want to talk a little bit about prompt care?
Good morning. We do have prompt care clinic services. We started this just around about almost 2 years ago now, so just about the beginning of the pandemic. We have one nurse practitioner right now. Her name is Rachel Fott. She sees patients in what people know as the old St. Joe's Hospital in Aberdeen. So that is a medical office building. It's been transformed into that now. And currently we're doing services only for patients that are already established with our medical group. And we can see patients on a same day or next day basis if you can't get into your primary care provider. The other thing that Rachel has been doing for us is seeing our respiratory clinic patients. So as the pandemic developed, we set aside time in her day, and she sees patients with respiratory symptoms so that we can keep patients with those symptoms outside of our clinics and have those be more well patient-focused clinics. Next slide, I think, is me also. Okay. Is this the Kaplan?
Yeah.
So we do have cardiology services now in Aberdeen. We are working with a company called Cardio Solutions, so they provide us with a cardiologist. And we have an outpatient clinic, and then we also have urgent and emergent services for STEMIs that we do at the hospital. So this has been a great service that we are able to provide and have helped many patients throughout the last 2 years that we've had that service.
Nice and quick. Thank you, Elizabeth. The Cardio Solutions relationship that we ended up establishing has been going on for about 2 years, and we do roughly about 100 PCIs a year, so life-saving procedure. Prior to that, you would have had to go all the way to St. Pete's for that very same service. So, and like most of us know, when it comes to cardiac issues, the faster you can get the issue resolved, the better it is for everyone. So with that, I guess, Susan, do you want to take questions now, or do you want to wait till the end?
We'll just go ahead and let Harshim present, and then we'll open it up for questions across the board. How does that sound?
Harshim, sir.
Thank you. Good morning, everyone. Can you hear me? Awesome. Thank you for having me. My name is Harshim Ross. I'm with CMR Community Health Centers. I'm the Senior Vice President COO. As you guys know, we have clinic out here. I have brought with me the health center administrator for that clinic. Her name is Christy Potter. She's sitting here in the front row. I just wanted to be present to really be able to answer questions for you guys, because I know there's a lot of questions that the community has in reference to CMAR, the services that we provide, and what the future looks like for CMAR here. I can share with you currently that we do have a MD on board, Dr. Kerbacher. We have another MD that will start in the month of December by the name of Dr. Stephen Drasnin, and we're also vetting a nurse practitioner that is from the Ocean Shores community that will hopefully start in the next 3 to 4 months. So we are really looking to grow and expand our services to really be able to serve you better. In the year of 2020, we had roughly 3,500 patients assigned to the Ocean Shores facility, and we conducted 10,500 visits in the year of 2020. To date, we've done 6,727 COVID vaccines for the community, and we continue to vaccinate to help get us through this pandemic. CMAR is here to serve. We'll do the best that we can. We are working very closely with the hospital system, and Tom Jensen and I are in talks right now about what we can do to better serve, and also maybe provide some of those specialty services right here in the county, in the district, also within the CMAR facility by housing some folks there maybe 1 or 2 days a week, just depending on what that looks like. But I can assure you that we are doing everything that we can do to serve this community and serve it well. Thank you.
Thank you. I think we'll just go ahead and we'll open it up to questions, and I will do my best. If you have a question for a specific individual, or if it's just a general question, and then I'll let them answer as they see fit. Questions, it's up for you. Yes, sir.
A couple weeks ago, I heard this Christina Hawkins from CMAR, who's their education director, on the radio, and she said that they get money, some city funding. And my question is that, while CMAR does give COVID vaccines out to people that aren't their primary patients or whatever, if you want to get a vaccine in this, or not a vaccine, but a flu shot in this town, you got to, and you're not a CMAR customer, you got to run clear over to Aberdeen and plan on an hour and a half drive. And if you do it like I did last week, then you find out Safeway doesn't start giving them out till noon, so you need to hang around for a while. And I mean, we went to Portland and got our third COVID shot, because it's simple. You walk in, no questions, they give you your shot, and we were good for the COVID. But now we're still we'll probably be going back to Portland, I guess, on Christmas to get our flu shots, because you can't get one in Ocean Shores. It's just crazy that you got to drive so far to get any kind of medical service in this town. Pharmacy, they say that, well, someday they're going to move, and they might have room then to get flu shots, but right now they can't do it over there. And the only other place we got is CMAR, and they won't do it.
Thank you for your question.
So we do have flu vaccine, and just like the COVID vaccines, we do not hold vaccines for just our established patients. We will vaccinate anyone that shows up to our doors, regardless of whether you've seen us or not seen us, or whether you're established with us. If you've had that experience, I will give you my card. You can reach out to me directly. I will get that corrected if that is what you've experienced.
You can just call the switchboard and they'll tell you. They'll tell you. If anybody in here knows, they'll say, sorry. You have to be patient. Yeah.
Okay, well, I am telling you from my mouth to your ears. You do not need to be an established patient with CMAR to receive any vaccine of any nature. Okay? So if you hear different, you can certainly reach out to me and I'll get that corrected for you.
Thank you, Oisin. Yes, thank you.
My experience is if you can get a hold of Christy directly, she takes care of people. The other people give you a runaround.
Well, that's a good compliment for Christy. Is there a special phone number? Maybe people are not calling the right number.
No, they're calling a general number, and we do have staff that are answering the phones. But again, I will ensure and I will work with Christy to make sure that those folks are giving you the appropriate and correct information. And all of our staff are here to serve. Again, if you ever have any experience that's negative in any light, please reach out to Christy Potter. You can also reach out to me if you have any questions or concerns, and we will get those addressed.
Thank you. Yes, Marcy.
I just have one more comment. You can get testing as well. At least you could, maybe you guys know more, but you couldn't get that. If you wanted a COVID test, you couldn't go to CMAR unless you were a non-person.
That's also not.
You're going to do community testing.
What we didn't do is, so we did do testing. You can go to CMAR for testing, even if you're not a CMAR patient. What we did not do is, because we didn't have, again, the staff, it's a very small clinic. What we didn't do here in Ocean Shores, like we did in some of the other counties, is the community testing, meaning have a line outside and have staff outside and have folks kind of rotate through. We just did not have the manpower to support that effort. But if you are in need of a test, whether it's for work or back to school or for travel, we are providing those tests.
Thank you. Catherine. Okay.
So I just wanted to point out, in case folks don't know, that there is a testing site set up in the west parking lot of the convention center right now, free COVID testing. I do not know how long the duration is, but there is testing available just as a drive-up. When we walked by, there was nobody there.
My question was,
Thank you.
who's sponsoring that COVID test? Is it CMAR? Is it the city?
Thank you. Good question. Does anybody know who's doing the free COVID testing out there? John, do you happen to know?
I didn't see a sign.
I don't think it's the city that's paying for it. I think it's the whatever. I think maybe the county or something.
Okay.
But, I'll reach out and find out the time frame and who's paying for it.
Thank you. So the possibility is it's Grays Harbor County that's actually putting that on, and we'll get confirmation of that. Thank you. More questions? Yes, ma'am.
Yeah, I was wondering if the hospital provides emergency care now for stroke victims, or do they still have to go into Olympia?
Stroke victims.
Yeah, no, I appreciate it. So we do provide certain levels of care. So if you were to have a stroke, come into the organization, they'll do a head CT on you within 90 minutes. If it is a blocked artery, they will go ahead and stent you in the facility and then keep you for as long as it takes. For some people it's quick, it's an overnight stay. For other people, they can actually come in and walk out. So the services are rendered there. We also have a relationship with St. Pete's for neurology services. So if our ER doc doesn't feel comfortable, he can have a, if you will, electronic teleconversation with a neurologist at St. Pete's. And also they'll also utilize that service and also see the patient, and then the neurologist will also see the head CT to make sure there's not a brain bleed. If there isn't, we unfortunately can't take those patients, and we ship them as fast as possible.
So in order to get the shot that we needed, like the PPA, we still have to go to St. Pete's?
No, the shots we do at the hospital, yeah. It really goes more about, we don't have the ability to resolve any brain bleed injury. So if it's anywhere else in the body, around the heart, we'll take care of it right then and there. And we can, what they call the thrombolytics is what they call it. So they would give that to you if there's no head bleed, and that would hopefully open up the arteries. And then again, if we go back to if there's blockages, we have a cardiologist and all the services on site. So, but great question. Thank you. I appreciate it.
Thank you. There was another person raised their hand. Mike, in back.
Hi. Talking to a lot of citizens here in Ocean Shores, we're a growing community, third fastest growing city on the coast, the West Coast. We really want to have our own medical center right here in town. And we've heard it before where, okay, we'll look at it and we'll come in and try to help you out. And that doesn't seem to be happening. And I've talked to a lot of people and they've told me it's impossible. You can't have a medical center in Ocean Shores because of the district. But then I go check on things. I go to the federal government, and it's the Rural Department, U.S. Department of Agriculture. They have a grant called the Community Facilities Direct Grant Application. I don't know if you're familiar with that.
Is it a HRSA grant?
Pardon?
HRSA or USDA?
It's USDA.
Yeah.
And they said we are prime candidates to get a federal grant to build a medical center here in Ocean Shores. So I have a group that's looking into this. We're going to present it to our council, and we're going to go down the road and getting the help we need here. We can't have all our firemen out of town taking people to hospitals and leaving us at risk. Last year we lost 2 houses due to fire because they were taking people out of town to go to the hospital. We can't continue down that road because we're growing. There's more and more people moving here. We need a facility here so that when there's a problem, they can go right here and get it taken care of. And if you guys don't want to support that idea, then we're going to go down the road and try to get this grant and make it happen ourselves. So I'd like to know what your opinion is on this grant.
Yes, so I'm a little bit familiar with the grant, and there are facilities that have been built to do that. And I think really Representative Chapman said it best. It's really about how do you get paid for it. You can get a building built, but you still have to staff it. And Harshim and I have had this conversation about what's the best way to get people to come and live in these rural areas. I mean, and it's not easy. And Harshim will tell you that, I mean, one day we'll have, you know, the perfect amount of providers, and the next day we won't have any. And that's not fair to a community either. So it's really about trying to figure out the right combination and the right size facility for any organization to come here and build. It's not just a building. I mean, I wish it was easier than that. I mean, I wish it was just getting the money, but you're correct. USDA does fund certain levels of facility sizes, as well as I mean, they've funded everything they funded a hospital in Puerto Rico for I don't know how many millions of dollars. So you're absolutely correct. And I'm more than happy to
take advantage of it.
Yeah, I'm more than happy to have a conversation with you offline, and if that's something that you guys want to look into, I'm more than happy to participate. And I'm sure Harshim is as well. It's not that we don't want to do things, but we struggle with COVID, and now that COVID's hopefully winding down, it might be an opportunity to have some of these conversations.
And a follow-up to that is that a lot of these communities I've talked to that have gone down this road and got these grants, they've got doctors and nurse practitioners to come in and work there. You come work for us for 3 years, we'll pay for your education. That's part of the deal. It's just part of what you have to do, and that's what these communities are stepping up and doing so they can have, you know, the help they need.
Absolutely, I'm there with you. You know, long term, I think there needs to be some reimbursement. I mean, to pay for it ongoing operationally, and that might be a conversation that we have a conversation with the state.
So is this something that you guys could look at with us, or should we go down the road by ourselves?
I'd be more than happy to look at it with you. And I've applied for USD money in the past for a variety of different things, so I'm more than happy to have that conversation. But they're going to ask you the same thing that everybody else does at the federal government, is they want you to build a financial pro forma to make sure that it's long-lasting. And I'd be more than happy to help and participate with that as well. I mean, I don't think Harshim and I are here to say what you can or can't have. We're just trying to figure out how we can work together to provide services to the community. That's why we're here.
I know that we just got through an election here, and every person running for election said they would support a medical center coming to Ocean Shores. And I know most of the current council we have supports the idea. So if the support is actually there, if we join together, we should be able to make this happen.
Yeah.
It's safe to say there wouldn't be anybody running for office who doesn't support access to health care. I mean, that's like a layup in politics. Like, of course they're in favor. Here's what I face in my district. So I have Olympic Medical Center that's in my town of Port Angeles, and then 15 miles down the road I have a very thriving, also one of the fastest growing communities in the state, Sequim. Primarily retired folks, primarily on Medicare, and Olympic Medical Center a few years ago, with the help of Congressman Kilmer, expanded their operations in Sequim, and they built a nice big facility. Unfortunately, during the federal government's last budget round, they drastically cut funding for these secondary facilities in small rural communities. Nobody knows why. Congressman Kilmer actually passed a bill to make the funding permanent, but the Congress didn't follow through even though the bill passed. Strange thing, but politicians don't have to fund things that they vote for. So Olympic Medical Center is now pulling back services from Sequim back to Port Angeles. Secondarily, my son is a recruiter for Olympic Medical Center. His job is to try to find people to work for the hospital. They have hundreds of positions open. He goes around, he goes to job fairs, he talks to other, he's trying to recruit, and he can't recruit anybody. They offer huge, what I would consider sizable signing bonuses. Some of them close to my yearly salary. Medical reimbursement for student loans. They're doing everything possible, and they're hundreds of people short. So if you expand here, you're going to have to make sure you can find a workforce. You're going to have to pay top salaries, because newsflash, Washington's housing market, they can't find housing. Port Townsend, the hospital can't find, even if they want to work there, they can't find any housing. Port Angeles, where I live, there is no housing. And when I say no housing unless you're going to spend $400,000 to $800,000 for a home. I could not afford to live in the home I live in. It's unbelievable. No rentals left. No apartment buildings. So we have a challenge here. And I also want you to have access to health care. But building a clinic and not having housing and not having people, you'll end up with what's happening in Sequim, where they're losing services. And it's just a challenge that we face. And we added money to the community colleges to pay for more nursing students. Peninsula College could run 2 full nursing classes right now. They don't get any applicants. Not that many people want to serve. We're just having a real struggle there. So, all for it. You should look at it. You should try to see if you can get the grant. But at the end of the day, I suspect that these 2 gentlemen are having a hard time filling the slots they have. And I don't know what that answer is. I got to be honest. I don't know how we force people to take jobs in healthcare. I don't think we can.
Washington had something he'd like to add. Okay, I'll get to you just a moment.
Sorry. I just want to add that CMAR, we also take advantage of, part of our recruitment is that all of our sites qualify for loan reimbursement for providers and nurse practitioners and PAs and students. So we use that as a recruitment tool. It still hasn't really shifted the paradigm for us. And with that being said, when we're talking about rural communities and small communities, when you're recruiting and using those tools, you're getting the folks that are new grads. And so putting a new grad in a rural community alone is very hard on that provider. And the other piece of that is you want consistency. I'm pretty sure everyone here wants to continue to see the same provider, have some consistency in their healthcare, where they're not telling their story over and over and over again to an individual. Well, when you recruit this way and you're using these tools, you'll get a provider in, but they're only going to stay long enough to pay their reimbursement. And we have had instances where they decided, you know what, I'm just not built for this, it's too far, and they leave anyway. So, as both these gentlemen have stated, recruitment is important, staffing is important. I said, when COVID hit, in the midst of COVID, our teams were out in the communities, working long hours, working early hours, just trying to, get the community taken care of, in all of our counties that we serve. And, I was in the military, and I'm retired Army. And, when I was in the Army, I was on the front line. I was an infantry guy. I was 11 Bravo, all right? Was turned 11 X-ray. And what I say to these healthcare workers is, back then when I was in the military, I was on the front line, and now it's them. And now we get to see who's really in it to take care of people. And you've seen, all of us have seen a great influx or great deal of number of folks that just kind of exited the field. I've seen providers exit the field because they just are not up to the task right now. And so all of us here are working really, really hard to not just find providers, but get some staying power out of these folks so that we can better serve.
Thank you. Thank you. Questions?
Real quick. I'm just sitting here and I'm watching Elizabeth shaking her head at everything everybody's saying. So I know, Elizabeth, you work really hard to do the same things. You recruit, you offer whatever you can to get people in here, and it's just not as easy as you all might think, and if the people weren't there. Is there anything you'd like to add about the program with the nursing students? Or
well, we do have one thing that we have started, and this has come out from recruiting, is that new grads are what we get, and you have to provide them with support and mentoring to get them through their first year, or they won't survive as healthcare providers. And so we've partnered with the University of Washington in a Primera grant in order to offer nurse practitioner fellowship programs. And I know they do that at CMAR also in some of their facilities. And so what that does is provide a new grad nurse practitioner who is a fully functioning practitioner the support that they need in their first year of practice, so that hopefully they will continue on with you and they will continue in healthcare and feel supported so that they can be here for their communities to serve. And that's just one area that we're trying to navigate in order to get providers here and to keep them here. And our goal is to add more fellowship practitioners and to hopefully get them into some of our specialties and areas that desperately need help. So we currently are doing family medicine, but our goal would be to add internal medicine or pediatrics or things like that to be able to help serve this population.
Thank you. Christy, did you have anything you wanted to add? Okay, thank you. Yes, ma'am, question.
I was a major in the operating room in the Air Force, finished up at the KCBA. And one thing I noticed in this community is that, as everybody has said, there's a lack of medical care. But not only is there a lack of medical, there's a lack of urgent care. Before you can even have a hospital, you need to be able to provide urgent care. Over the 4th of July weekend, the number of people that I saw that came into town to support this area was absolutely breathtaking, and the amount of air flights and things to get people who were ill or injured was, I mean, they were having to go all the way up to St. Joe or further beyond. That was one thing. So it's urgent care, and then the commitment to this community, that they're in it to win it, and they love the people that are here versus living in Mukilteo and then coming into town for 3 days, so then they're gone. Or an orthopedic surgeon that I saw Friday who lives in Hawaii is here for a week. I mean, people that will invest, who are physicians or nurses, that will invest in this community to take care of, I hate to say this, generic, because I am part of that, generic people. So number 3 is the elephant in the room. And I am one who really supports frontline doctors and medical freedoms. And I hear a lot of people who do not want to, they're not going into medicine, or they're leaving medicine or nursing. And the word that nobody likes to hear is mandates. There needs to be freedom, that you're not forcing people into taking the vaccine. That is huge. You're losing people. I know people who are moving to Montana that are experienced medical doctors and nurses over the fact that, I know that this is not a popular thing to bring up, but it is. It's medical tyranny, in that we live in a free country, and we should be, as medical staff, be able to determine what is best for us and not be forced by the government or by Pfizer to take something in which it is, if you research it, is not good, and you're gonna have booster after booster after booster, and you're gonna be committed like a diabetic to a vaccine.
Thank you. I'm going to let the panel respond if they would like to.
Look, if I were the governor, I would not have mandated vaccines.
Right.
That's probably not the most popular position in my district, but I just wouldn't have. But the governor did, and only he has said, this was a direct quote, only he can keep people safe as the governor. So, I don't agree, but he is the governor, and a number of us in the legislature tried to engage with him. I'm not going to bash the governor, I'm just stating facts. He is the only one with the authority, and he has chosen to put in a vaccine mandate, and that's under the authority that he's been given by you, the voters. He had that authority.
Thank you, but there was another part of that question, and it was to do with urgent care. Would either of you like to respond to that? And maybe explain the difference to the audience? Question?
No. We'll tag team.
All right.
Well, I think by definition, urgent care, I can only speak from a CMAR perspective. We just do not have the resources to be an urgent care, right? Because, with urgent care, there's a lot more critical tasks that are being done, not just, coming in and getting an x-ray, but there's casting, there's other things, there's orthopedic things that need to happen that we just don't have the resources to do. That's why we take walk-ins, like you can walk in and be seen for a routine visit, or just an ill visit, but we just don't have the resources to provide urgent care. I think, while I guess see the perspective of having an urgent care before a hospital, but I think that's kind of putting the cart before the horse, from my perspective, because that urgent care needs to be somehow supported by a hospital or be able to feed a hospital, because they're not, even with an urgent care facility, they're not going to be able to do everything, and they're going to need to push those individuals out to the hospital systems to get the rest of the care, because that's just a quick fix. Right? It's like putting a Band-Aid on. Right? If the bleeding continues, you're not going to put another Band-Aid on top. You got to send them into the hospital. So I think it's kind of putting the cart before the horse in that instance, and we just need to kind of Tom and I are talking about how do we better serve and get those resources to you. So that's what I have.
Yeah, I would just say that Harsheen's right. I mean, our focus is really to figure out how we can work together, and then slowly, with the opportunities that maybe the USDA has and some other things, and maybe the state, to figure out next steps. Harsheen's right. Urgent care really just is a patch and go. Most of the things that you'll find in urgent care, people are looking for X-rays and a handful of things that have to be read by a radiologist. So Harsheen's 100% right. It'd be better supported by a hospital. But those are the things that we need to make sure that we're working together on. The last thing I want to do is find ourselves competing in a service area where there really isn't enough volume to compete. So our goal is to collaborate. So thank you.
Thanks. Thank you. I've got Randy, then Nani, and then Heidi. Randy.
Mr. Jensen, Mr. Ross, we've been down this road for the last 17 years I've been here. Originally, we tried to have our own hospital district before your hospital district was created. The reason was we had no services in Grace Harbor community. And that happened because Grace Harbor community used to have Dr. Wong and Dr. Tro here before they sold the business to Dr. Holmes. Dr. Holmes left and CMAR came in. CMAR used to be up the road in their little building up the road. And I'm befuddled that you're bringing Dresden back, because the amount of complaints in this community as to him, that's why he left and was taken away. So I'm just befuddled on that one. So
All right, can we
But
get an
also
answer on that one first?
as to the hospital, when you came out here and at the high school, the whole discussion of services for your hospital district was we're going to do something for you. Hogan's Corner was available, 121 acres. Between you, the county, Timberland, and Grace Harbor Community, for less than $200,000 each, you could have bought a 121-acre cable campus with over 50 feet elevation, would meet the hospital requirement to be out of the tsunami zone. Everyone sat on their hands for that one. So we've still never gotten anything, nothing. And we see every new development is to the east. Montesano, Aberdeen, Hopewell, all those doctors, all those services are there. Even our radiologist, our chiropractor got rid of his x-ray equipment. There's x-ray equipment at CMAR, my understanding, other than dentistry, and you don't cross-train a tech to take care of it, so you could even have x-ray services here. We're always off to Aberdeen or further
Randy,
to get
thank
services.
you.
So we need to
let me hand off the microphone.
redirect. Okay, we need to redirect to what is really needed here. And
Thank
yes,
you.
I know it's about $13,000 if you figure out what you need for, if it was urgent care, a month, for a doctor or a nurse practitioner, a receptionist, a lab tech, and more likely not, their back staff, nurses aides, nurses assistants, or RNs.
Thank you, Randy.
I've done the numbers.
Thank
and
you,
Tom
Randy.
knows-
Let them answer.
Well, I'm just
Thank you.
finishing.
I know you got
Tom
plenty more.
knows we've had these discussions for years.
I know you
As I
have.
said, 17 years.
The rest of the people have not heard the answers here. So
Randy, I love you. You're a great guy and you're passionate. How are they supposed to expand when we're paying them 60 cents on the dollar? They're barely, Tom's barely if it wasn't for the money we were directly giving him, he would have been cutting back services. That goes back to my first statement. The federal government and the state government only give them 60 cents on their dollar of cost, which we now know their costs are going up as they try to pay more salaries, they try to recruit people, they're trying to provide housing up north, or whatever the hospital's thinking of buying housing up north to provide housing. My point is, you can't get mad at them for not expanding when if it wasn't for the state, if the state wasn't doing a better, they would be cutting services. Olympic Medical Center North would be cutting services. The federal government, I don't think people realize, does anybody have anybody in a long-term care home? A family member? So if you do, or if you visit, ask the director, how many staff is he short, she or he, and how much per dollar of service does they get reimbursed? That is a crisis that no one even talks about. I know you're upset.
That's the legislature's job to.
It's exactly right, and that's why I'm here. You need someone to be angry at. Be angry at me for not funding Medicare completely, me alone, because I'm here, and then you can be angry at the federal government too. Unfortunately, I don't even serve on appropriations. No excuse. I'm here to take full responsibility that the state doesn't meet our obligation. I will never shirk from that. If I'm not doing the job you like, you'll get a chance to pick somebody else who maybe can get the job done. I'm explaining the facts of how challenging. You can't be mad at them. You have to be mad at me.
But this has been 17 years.
Thank you, Randy.
Of the same.
Thank you. Randy, we love you. Thank you for your passion.
As an investment and use it for your staff housing all the way to today.
Thank you, Randy. We're going to let you take this up with Representative Chapman at the end, unless he runs out the door before we get to him. But I don't think he'll do that. I appreciate that, Mike. Thank you for that. I've got Nani, Heidi, and then Corey in the back. Go ahead, Nani.
I came here 3 years ago from Hawaii, and I was trying to find a PCP for me. That was the most difficult thing to do. I utilized your facility over there at CMAR. Now, as far as equipment, your X-ray equipment, you had a trailer that came in from Aberdeen to take whatever X-rays we needed, including mammograms. This was done like a portable thing.
Yeah, yeah.
And then they told me the reason is there's no place where you guys can put this. And then later on, we lost the student doctors. They were awesome. 3 years, they were up to date with what needed to be done medically for people. And then they were gone. Then we found out they don't want to come here. A very good friend of mine also told me, we don't pay that good. So they ended up going to Seattle to get their things done. And she would have fit into our community very well because geriatrics was her specialty. And then the other thing that I wanted to bring up to your attention is we have fire people that are commuting and transporting people from over here all the way out there, and sometimes they have to be on the road for 3 hours, one trip, and then coming back another 3 hours. We lose fire people in our town. We need to set up something where they can work together with the fire department, and we don't have this, as we say in Hawaii, cook-up or hole in the schedule. It's gotta be done.
Thank you, Donnie. Response?
So I just want to be clear. So, because I want to answer your question. So you say you're receiving services here at CMAR, and you had a PCP at one point, right? We recruit and try to keep providers here. It is very difficult. It is. We, as an organization, have been committed to our providers and to really look at the market and look at what we can afford as an organization to pay the providers to be where we need them to be. We've even given increases to some of our providers in some of these areas to get them to stay. So I don't know that it's always a financial thing, but it's also, when we're talking about the younger generation of providers, the younger group, they want to be in the city, believe it or not. They want to be in those counties or areas where they can get out and do things. So we lose some folks to that. You're right. So we've had students that we've sent out from Seattle. They go back up to Seattle, but that's their choice. We don't force them to. The X-ray services that you're talking about, the mammogram. We work with the different organizations to send the vans out because we don't have the ability to provide some of those services when we're talking about the mammogram and things like that. So we do ask them to come out to assist us with those. We do have X-ray in the clinic, and we do cross-train our phlebotomist there. She's a phlebotomist X-ray tech, but we still have to send those X-rays out for readings because we don't do the readings in-house because we don't have the staff or the providers to do that. So again, we're doing everything that we can to serve with the staff that we have, with the teams that we have, and we continue to recruit, and we're continuing to try to expand on those services for you.
Thank you. Heidi.
So my question is related to emergency care here in Grays Harbor. So before I ask that, I want to give a little bit of background. So some of the things that we've heard here in the community is that there's only one ER nurse at the ER, and I don't know if I'm part of this. I'm trying to validate, Second, I know that our local medics and our ambulances have frequently had to go all the way to Olympia, as well as I've heard that some in Hope William, Aberdeen have to. So my question is this accurate? And what is the situation with the ER there at the hospital, and what needs to be done? What can be done to improve it so that we can get service here in our own county?
Libby, at least normally, I won't say it's never happened, but normally there's more than one nurse in the ER. And usually on a mid-afternoon, there's usually about 4 or 5. And there's usually always a physician and always a PA, physician assistant. That's normal. I can tell you after the pandemic that ER staffing has been crazy. So there's been times where we've had to take nurses from the floor and bring them down. And if you're a floor nurse, they're very different in scope of what they have the ability to do in the ER. So for some of that, I would say for sure that that's definitely happening. And for anybody in EMS, fire, then you know for a fact that we've definitely gone on divert, not just, so traumas don't go on divert, even though there's some conversation about what that really is. Trauma should always be dropped off, the patient should always be stabilized. But if the patient is stable and we don't have anyone to take care of them, then we'll go on divert. And we've probably gone on divert more over the last 6 months than in my whole career at the hospital, and I've been there about 10 years. So some of that's true. We don't like to go on divert. We don't like EMS to have to leave the county because, believe it or not, without patients, there's no need for a hospital. So going on divert doesn't help anybody, doesn't help the bottom line, doesn't help the patient. But we are definitely struggling with staffing. It's everywhere. I mean, Harsheen talks about what's going on at CMAR. I will tell you we have the same problem with physicians, with nurse practitioners, with MAs, medical assistants. We struggle all the time keeping them. It's not an Ocean Shores phenomenon. It's and I won't even say it's a Grace Harbor phenomenon. It's the United States at this point in time. It really is. People that I thought would never get out of the business are getting out, and they're getting out at a younger age all the time, or transferring into a different field altogether. It's disheartening.
So just for clarification, you're saying it's strictly a staffing issue, this diverse?
Absolutely.
Or is there
yeah.
other issues?
No, there's a rare time that we would go on divert if there was equipment failure for stroke, so stroke divert. But most of the time that doesn't happen. Right now
we lost recently because all of our ambulances were out of town. We were actually on divert that day and we had all 3 ambulances out of county. So that was a big issue for us. It's an even bigger issue for this community because of the fact that we don't have anybody else to come fill in for us when we're out of town. It's like maybe Aberdeen or Oak Creek could cover each other. We don't have that ability. And then I agree with you. We have been on divert more than I've seen in my career here. I think we've been out of this county 3.5 times more than we have any other year. So it is an issue. But one of the issues, my first question is, recently we've had to deny the request for divert because of patient status. And we've shown up to an empty ER with what appears to be a fairly well-staffed ER. And they all look at us and go, we don't know why we're on divert. And and so my question, and then we got a text message from our MPD stating that we're to ignore divert status until November 20th for some reason. I'm not sure. I guess my question is, what happened on November 20th?
That's a good question. Don't know. I have been in contact with Dr. Buck, who you're referring to. I make the assumption. So we'll have to figure out what went on in the building. But yeah, I mean, I don't know why there'll be times in which they feel like either the ED is too stressed or they have stress somewhere else within the system, and it's usually the house supervisor that makes the call. I know that they went on divert, and we are supposed to do a reassessment every 2 hours, and I think we need to get back and figure out what's going on. So
yeah, it sounded like there was a miscommunication there between the house soup and the staff. I mean, the nurses were pretty upset about it and wanted us to make phone calls and do stuff, so there you go. I thought we got to talk.
I appreciate it. I totally get it.
Yeah. Second question I had was something that we've all kind of talked about in the EMS service here, because we don't have an emergency room here. We are this community's emergency care, and we see it every day, and it's very important for this community, especially for the demographic here.
Sure.
So is there any talk at your level with the managers of the city, council folks or politicians about not diverting the beach EMS crews, because we're already half hour out, and us going all the way out to even Summit for us creates a 3-hour situation where we're low staffed and we can't fight fire, we can't do CPR appropriately, all that stuff. As opposed to like Aberdeen and Hopeland can cover each other, and they have District 2 right there in Central Park, so they have more folks within reasonable distance. I know that we've talked about it at my level And I don't know if you've heard anything about that as far as maybe not diverting the beach crews, because us in South Beach are all by ourselves out here.
Yeah, no, so Dr. Buck hasn't said anything to me, and I talked to her as recently as last week, so, but I'll bring it up to her if that's okay.
Yes.
And find out what her, you know, there's politics everywhere, even in EMS, and that's not my world, but Dr. Buck definitely could, I'll have a conversation. You got it, you got it. Hey, appreciate what you do. It's a tough job.
Thank you.
Thank you. More questions. I had Jeff and then Jim. Actually, Jeff, hang on. Jim had his hand up first, and then we'll go to Jeff. Go ahead, Jim.
Okay. Hey, thanks very much for coming out. This is, to me, a really key, important issue. And what I don't want to be is 17 years from now and having this same conversation. It seems to me that this needs to be a collaborative effort and not just we leave here and then CMAR says this and the city says this and the county says this. What about, let's get creative, and we've got really good input over here from a citizen who's just trying to solve the problem. What if we were able to create a, I hate the word, committee that actually had a goal to get things done? Let's consider a couple of things. Seabrook, Pacific Beach are facing the same thing. They desperately want a walk-in clinic and an urgent clinic and that, and they're trying to take steps for that. We can't, we're having a hard time trying to justify one, much less two. Is that why can't we reach out to them and work together? One other thing is that I visited this issue, whatever, a number of years ago. And it was, you know, if you work with the Quinals and made the medical facility on tribal property, that they get bigger reimbursements from the government than we do as non-tribal entities. So here we've got Seabrook, Pacific Beach, we've got the tribe, we've got the city, we've got the medical organizations, and we've got concerned citizens that want to make something positive happen. That's what I would suggest, is that let's get some leadership and work together towards an end.
Yeah, I couldn't agree more with you. And I know that their city council members are starting to open up and having those conversations. I think that the key would be to take a person like yourself and make them the chair for that committee. Come on.
Jeff, go ahead.
It is true that the tribal medical facilities get a much higher reimbursement. It is also true that they do not have enough people in their employment, and they're constantly up north. The Jamestown tribe is a huge community leader in healthcare, and they are constantly recruiting, and they do not have enough folks. And they just went through a long 2-year process of trying to cite another clinic to treat folks specifically around heroin addiction and meth addiction. And they fought a 2-year community battle for a community that didn't want additional healthcare services. So just because you all want maybe a clinic somewhere with the tribal's perspective and the things that they will be treating, not everyone will agree that they want tribal expansion, but they still can't find the workers. And even if they find the workers, case in point, I'm just curious, how many, if you added 50 healthcare workers to this community, where would they live?
That would be very tough.
And that's your job.
That actually isn't, that one I disagree, that isn't my job.
They just sold the old elementary school or high school here where the sheriff's substation is. It's sale pending. I even talked to the school district and made the suggestion, if you need faculty housing, because they couldn't even find faculty housing, and we need low-income housing, that's where you build it. You already own the property. The Quinault bought the 121-acre Hogan's Corner. There's where you go talk to them. And as I said, it's 50 feet above sea level. Tsunami safe. Go talk to them. Maybe they'll work with you. CMAR should be working with the hospital to get that urgent care because the building already exists. When they close their door at 5, nothing stops more personnel to be there for a different shift. You have to start being creative with the resources you've got. Not trying to be, separate little islands. It's wonderful you changed the name to recognize that you are a bigger entity as the hospital, but you have to provide the services as promised when we voted for a hospital district.
Thank you, Randy. So what I can tell you is that I agree with you that everyone needs to be working together, and that is the reason that we brought together everyone today, and they all agreed to come so that they can hear what you have to say. They have already expressed to me that they are working together, but I'm sure that their commitment will be even stronger after they've been here today. I'm going to take a quick break because I want to do this raffle before the end, before you all jump up and leave. So I'm going to ask the guy who's on the hot seat, who's responsible for everything, State Rep Mike Chapman, to make a ticket. Then the rest of the people will be angry with you, right? All right, so you got your tickets out? I'll let you read. Who's going to read the numbers here? Got your tickets? Here we go. This is for the blood pressure monitor.
Which I need. Constantly. 1511339.
Read it again, please.
511339.
Yay! Mike, would you please give the monitor right here, it's on the table, to our winner. Thank you very much for coming today. And Jeff, it's your turn for a question.
A few minutes ago, one of you said you don't understand why doctors and medical people are quitting. And I'm stupefied. I'm a long way from being in medical. I was a computer guy. I first learned about it in 1979 when an OB doctor said, you won't believe the paperwork and the regulations I have. I'm going to guess that no legislature in anywhere in the United States has reduced any legislation between then and today. The second thing is, imagine working all your life and you make a mistake and you get sued and you lose 2/3 or all of what you have by some attorney because you made a mistake, and all of us make mistakes daily. So expect perfection, and that's not going to happen because we're human beings. And then everything, you get sued and you lose everything. So ask yourself, would you go into that profession where that can happen to you?
Thank you, Jeff. Would you like to respond to that?
I think that's a really good point. You're probably right. I know we haven't in this state. We continue to add regulations to hospitals. We continue to dictate their staffing levels. There's a whole host of legislation that comes down the pike every year that makes their job more difficult. Many pieces of those legislation I actually vote no, much to the chagrin of my friends who are nurses and doctors, but there's lots of regulation. I will say we have now made it more difficult. I think you're going to find that people are going to leave law enforcement. There was a whole host of pieces of legislation that passed that make a law enforcement job even more difficult. I voted no as a former law enforcement officer, but it doesn't matter whether I vote yes or no. These are pieces of legislation that are passing with large majorities because, in all fairness, I have other colleagues who are in different districts who don't see things the way maybe some of us do in the rural areas, and they have a different place of where they want to take this state. And so that is the challenge. And for those of us who live in the rural area, we do now. Tom will remind me it was a representative out of West Seattle that approves the funding for his hospital so it's a give and take. She doesn't like funding extra money to the Grays Harbor community. She makes no bones about that she doesn't like that, but she will do it because she believes in the greater good for our community. So it's a give and take, but we're not. And Tom probably can explain some of the laws we pass a whole lot more than that. But I hear from so his counterpart up north is a gentleman named Daryl Wood. Daryl's a fine gentleman. He's the CEO of Olympic Medical Center. Daryl and his team routinely meet with the three of us, Representative Theringer, Senator Bandaway, myself. During session, they will routinely give us a list of pieces of legislation pending and put a dollar figure. And I look at that, and I think I voted with the hospital's concerns about 90% last session. Again, much to the chagrin of some of my friends in the nurses union, but you can't keep layering on these costs while we don't increase the reimbursement rate. And the reason the reimbursement rates are so important is in the 24th legislative district, it'll be most of Grays Harbor starting next year, all of Clallam, all of Jefferson. By median age, it's the oldest in the state. Over 55 is our median age. Mostly a retired district, which means most of my district doesn't have private health insurance. They have it through their Medicare and then state-funded Medicaid. Private insurance reimburses them quite nicely. And for the hospitals in the I-5 corridor, where people are working for Microsoft and Facebook and Amazon and Boeing and PACCAR and all those places that offer private insurance, the legislators in the Seattle area don't hear about Medicare and Medicaid reimbursement rates because, quite frankly, their hospitals have a much better payer mix with the private insurance. In my district, we don't have a lot of employers that offer private payer mix insurance. My guess is Olympic Medical Center says they're about 68% Medicaid, Medicare. I don't know if that's close.
About 80.
You're 80?
Total government's 80.
So in the I-5 corridor, the numbers are switched. So again, the issues we face are really a rural-only issue, in my opinion.
I just want to add that, when we're talking about healthcare plans and insurance plans, I can tell you firsthand, I talk to the health plans regularly. I'm constantly, and Tom and I sit on a board together where we're always talking about how we can better serve the Grays Harbor community. But I personally have had conversations with the health plans that serve this area. I have staff that work regularly to help people get signed up for health plans, health insurance. Some of these plans don't cover a lot of the services that you need. So sometimes when you're looking at CMAR and, using our services and we give you a referral that for whatever you need and you have to go out of county for that service, like you going up to Olympia or things like that. That's not us sending you to Olympia. That's your health plan saying this is the only place that I'll allow you to go. So very often, we're sending you to a routine place that you should be able to get locally or at your local hospital, but your health plan is forcing you to now go out of county. All right, so I would encourage you to also, when you're looking at your health plan and what you're interested in the service, look at the services that you need and the services that they actually provide or are afforded to them. Because looking at the reimbursement rate of those services is going to dictate where they will allow you to go. All right, and certain, in Tom's case, if they're not reimbursing the hospital at the rate that they need to support the service, they're not going to be able to provide the service. They're not going to have the service available. It's not, I sometimes when I'm listening, I hear, all you got to do is this and all you got to do is this, but, and I'm not here to harp about red tape and things like that, because I don't care what wall you put in front of me. I'm going to figure out a way around, over, or through. All right. But I will say that does take time, and it does take more than just the people on this stage to do that. That takes you as well. So I'm actually thrilled to hear that you're looking into the federal funding and things like that. Because yes, it's out there. But of course, just like Tom said, it has to be sustainable. Anything that the federal government invests in has to be sustainable. You have to have a 5 to 10 year plan in order for them to even consider funding that opportunity. So me being part of CMAR, me being a newly assigned Senior Vice President, COO for the Southern region, you've never seen me, CMAR, at these events. It's important to me. It's important to me to serve the community. That's why I made a point to meet with Susan, to come here, to listen to your concerns. The things that you've said about the services or the lack thereof that you've received at Seymour that you feel like you should provide. I will guarantee you anything that we can do, we will do. And I don't have a problem with giving every single person in this audience my business card so you can call me directly if you need to. But I will work thoroughly with Christy Potter. I spent a week out here a week before last, Monday through Friday, sat in the clinic all day long, just looking at the processes, looking at what we're doing, looking at how the staff has served the community. Because I want to make it better. I want to improve it. I want to make it better for you, not for me, not for the team that's providing the services, but for you.
Thank you. We've got one last question. It was our lady right there. Yes, go ahead.
Yes, nobody brought this up, but why is it that a lot of the people here, a lot of the retail people here, when they have urgent care, end up going to Alma? Doesn't Alma have the same kind of problem we do?
Doesn't almost have the same types of problems that we do in their urgent care and healthcare?
Yeah, so it's an interesting question. So Elma gets paid differently than we do. So we don't get paid the same. So they're called a critical access hospital, and they don't do surgeries, and they get paid cost for the services they render. So they have the ability to offer more what I would consider urgent, emergent, primary care type services. It's not a bad thing, it's a good thing, or they wouldn't exist. I mean, so.
Why can't we have that here?
Yeah, so there's a bunch of federal rules and regulations, but the biggest one is that the program doesn't exist anymore. So. It's not my fault, I swear. If I could, I mean, Grace Harbor or Harbor Regional Health Community Hospital would be a critical access hospital, and I'd get paid cost-based reimbursement. We'd be talking about all kinds of fun things that we could do out here. But I mean, it's just, there was a question I think that was sent that said, why can't we have a hospital like the one, or a clinic like the one in McCleary? Well, that's a cost-based clinic that is run by Elma, so they're reimbursed totally different. They're reimbursed different than CMAR, and they're definitely reimbursed differently than our clinics as well. So when we talk about the federal government rules and regulations, some of the things that we can and can't do are about those rules and regulations. Not because we don't want to, but we just can't sustain programs.
Change rules and regulations somewhere, someone?
Well, I mean, I think that's some of the conversations.
No, Medicare, the federal program, nobody, states are reimbursed differently. So Washington State actually has one of the worst Medicare reimbursement rates in the nation. Nobody can, I've asked that question. I've asked it of our U.S. Senator, I've asked it of our U.S. Congressman. There's really not a good answer other than, and here's what I will never do. I think you could probably put a lot of different political folks up here, and they would quickly start blaming the other party. Well, you know, if I just had a majority, look, it is what the state's doing, you can blame me. I'm not going to blame my friends on the other side of the aisle who represent other districts, who are doing the very best that they can to represent their districts, and I'm not going to blame anybody else. I'm your representative. You're not getting the services you need. At the state level, that's my responsibility, and when I go back for the short session in Olympia, it'll be front and center on my mind, along with a whole host of other issues, including workforce, housing, transportation costs, public infrastructure, school funding, the list goes on and on. And we are in a time right now where it is time for elected leaders not to blame the other party. It is time for both parties to find the solutions together, and there's absolutely no right, no reason, no rhyme why with the money the federal government is making appropriate that our Medicare rates are not equalized across this country and equalized so that Tom and CMAR, and that they can provide the services that you demand, and that is something you should be demanding, and both parties need to get their heads out of their butts and work together on that. That is something you all should demand of every elected official. What is the bipartisan legislation you're supporting to solve this crisis? And if they don't have an answer, you need to find somebody else who will. That's my opinion.
So,
sorry, I do get a little worked up about this blame game. You know, it's got to stop in our country. Neither party has a monopoly on the answer. Neither party. Both parties have to work together for the good of the American people. And if they don't, I do fear for the future of our country as we continue to just tear ourselves apart over these issues that aren't partisan. Healthcare is not partisan. It's like potholes. When I was in a local government, potholes aren't partisan. Just fill the damn things. Right? And that's what you need to just, find those leaders who will believe that. Anyway.
And I can say, like, I go every year, and we visit both sides of the table to advocate for health care and services for communities just like yours. And so it's not falling on deaf ears. Nothing you say falls on deaf ears. Right? I can say I met him because I was lobbying to get services, to provide services, to get more funding, to provide better services. So this, like he said, both sides of the table are responsible. We're responsible as leaders up here, and we need your help as well.
So I'm going to give the microphone to each one of our guests to ask them to share with you or to encourage you again as to what you all can do to help them. That is what this was about today. We have to work together. Every time I hold a presentation for Community Voices, we always say, what can we as citizens do to help you? So in your closing, that is what I would like you to share, if you will. And I'm going to start with you, Lynn.
Sure. Okay, in winding up, I said this at the end of the city council meeting that Tom and I were at last month. Use our services. Find a practitioner here. Find a doctor here. Please use our services. Going by us and going to Olympia or Elma or back to where you had services before. I get the continuity and the consistency, and if we don't have the services here, you are going to have to bypass us, but use our services. The more you use them, the more patients we have, and the more money we'll get, even though it's not $1 for $1. The other thing I would like to share with you is Chris has brought there's a box over here, and it does have a postcard size information pamphlet in it, and it's actually all our services, the slide you saw that show the areas and the Harbor Regional Health facilities. I think it's very helpful, and thanks for putting that together, Chris, because it just will help you look on that card, and of course the website's useful as well, but please use our services. And if you have any questions, I'm here, I'm open to questions. I will find the answers. I call Tom regularly, share with him what I find or questions I get, and it helps me reach out and get the answers. So support your local facilities. See more as well.
Yeah, and support your local healthcare workers, your local law enforcement, your local EMTs that are really, folks during the pandemic, they've really been stressed. And that's another thing that we've got to make sure that they feel the support. Thank them. If you know a healthcare worker, if you know a long-term care worker, if you know a EMT, a police officer, and I'd be remiss, even our retail folks who during the pandemic continue to serve the public. Please be mad at me, and not just me per se, if you can spread the anger a little bit, but be mad at your politicians. When you hear a politician on TV bashing the other party, I don't care if you're part of that party, remember, no party has all the answers, and both parties need. These are complicated, the issues we face as a country. If we don't come together and say, you know what, there's some bipartisan solutions here. If we don't do that, nothing's going to change, and you'll be here in 17 years. I think these are bigger issues. It is time for the American people to say, would you people start working together on some of these issues? And that's what you can do. Hold us accountable, and if you don't like the job we're doing, then find people that you do like the job that they're doing. But don't be mad at these folks. They're doing the very best they can. The staff, please do not, I had to tell the folks in Squim, the public cannot continue to take their anger out. If you're mad at the governor over the vaccine mandate, you cannot take your anger out at the healthcare worker. You can't do that. Take your anger out at the politician who made those decisions. But please, they're under tremendous stress, and that is somewhat why some people are leaving, and there's other reasons. It's not the only reason, but the public right now is not treating our healthcare workers with the respect and the kindness you all are. I know you are. I can tell you, but some members, the anger out there is too loud, and our healthcare workers hear it. Be mad at the right person, but don't be mad at the nurse who's trying to do their job. Please, 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 be mad at me. My God, that's my job. Be mad at me. Send me the emails, send me the calls, but don't take it out on anybody else, okay? You're mad at the politicians. You're mad at the pandemic. You're mad at the economy. You're mad at the housing prices. You're mad. You're not mad at the health nurse. You're truly not. You're not mad at these individuals, the local official, the mayor, the city council. You're not. You're mad at the politicians, and then all the things. Be mad at me.
Don't be mad at me. What I would like to say is I'll make a commitment that our team and I will work together on trying to resolve some of the issues. Now that we have a chair for our committee, we can catch up with them if you're involved. And the HRSA grant stuff, I'm more than happy with USDA stuff. More than happy to talk to you afterwards because I've done a fair share of those myself. They're a little painful, but I'm more than happy to help you if I can with that. So, Hershey.
I want to say I appreciate the feedback. Most people don't like to hear it, but I actually appreciate it. I come from a place where I want to do better, and so feedback, be it positive or negative, always helps us improve our services. But what I will ask of the community is to, work with us. I know I won't say be patient because I feel like, sitting in this room, you guys have been patient for a long time. But I will commit to this group that, as Tom said, we will continue to work together to better serve. And please, at any point in time that you have questions or you're visiting a CMAR facility, there's a health center administrator on site. As I said, I have Christy Potter here in the front row. She's going to hang out for a little bit afterwards. If you have any feedback, any concerns with your care while you're in the facility, please let her know. Please talk to her directly so we can get those issues resolved. All right, thank you.
As I always say, the most important people in this room are you. This is something that's important to you. You've heard from our guests today. There will be some action taken. Thank you very much, Jim. Glad you were here and you were recruited. We appreciate that. Actually, you volunteered, did you not? There will be follow-ups. Please stay in touch. Please share some more refreshments. Our guests will stay for a short while. Again, thank you for coming to Community Voices. We do meet every Monday at 10 o'clock in this room. Thank you very much, everybody. Please give them a hand.